Crocheting through medical history. First of all, apologies for Gimli. He is yelling a lot. I don't know why. I just fed him because he was yelling and I didn't want him to be yelling, but he was still yelling. So, very, very sorry. Number 2, you may notice I sound much better today. Big thanks to my wonderful husband, Sam, who just happened to have just like a really nice microphone chilling in our closet. So, thanks to him for having that and getting it set up for me. Hopefully, this will be a little more bearable and sound more normal and less like I recorded it on my phone like the last one did. Now he's purring. So, if you hear white noise, that is him. Also, I'm very sorry if my mouth noises are gross. Still figuring out the sensitivity on this microphone. Kimberly, do you want to say hi? Do you hear him? Yeah, go away. I will try to adjust accordingly. May or may not happen correctly, but I promise I will try. So, welcome back. Crocheting through medical history. Today I will be talking about Ehlers-Danlos Syndrome, shorthand EDS. It is a hereditary connective tissue disorder. And as I talk, I remembered I'm supposed to be crocheting this time, so I will be crocheting a little amigurumi zebra. Because, explanation, medical professionals are often taught that when they hear hoofbeats, or the saying, when you hear hoofbeats, think horses, not zebras, meaning like they learn all the different diseases, but don't focus on the rare ones. Like if you see symptoms that match a disease, think of the one that's more common and more likely rather than the one that you learned about once in school and is like 1 in a million, if that's a lot of percentage. I don't actually know, but think of the likely diagnoses. Oh, I just crunched my teeth. I'm so sorry. It's going great. But people with EDS and other hypermobility spectrum disorders refer to themselves as medical zebras, because their conditions are often underrepresented and underdiagnosed, and not things that doctors think to diagnose them with sometimes. But sometimes the hoofbeats that people hear are zebras and not horses. So they're medical zebras. So I am crocheting a zebra. Please enjoy. Also, I'm crocheting a zebra. I always use patterns because even then things turn out looking really wonky, but I am not using a pattern today. I'm just freehanding it because I have made a lot of little animal figures, so theoretically I should know what I'm doing and be able to make some white with some black stripes. But it may not go well, so just be warned. When you see it, it might be bad, and that's just because my mind's eye is not good sometimes. Okay, let's start. Ehlers-Danlos Syndrome, or EDS, was first noted in 400 BC in Hippocrates' Airs, Waters, and Places, in which he described nomads in Scythians as having lax joints and multiple scars. It's thought that the scarring was caused by them trying to cauterize the joints to make them stiffer. Ow. In 1687, Job Janssen van Meekeren observed George Albus, a boy who had extreme hyperextensibility of his skin on the right side of his body only for some reason. But Albus could stretch the skin of his chin up to his chest, down to his chest, I guess, or he could cover his eyes with it. And then the skin on his knee could be pulled away from his body over 20 inches. As someone that does not have hyper elasticity of skin, that sounds so painful. But I will admit I did forget that I have like non-stretchy skin when I was researching this, and I just like grabbed the skin on my hand, like pinched it between my fingers and just pulled up, and it hurt because it didn't want to move, and I was just like yanking my skin off itself, and the nerves did not enjoy that. So I do not have EDS, and I'm not stretchy skinned, so that sounds very uncomfortable to me. Moving on, in 1892, Dr. Chernagabo. It's very Russian. I could not find a first name, or hopefully that would be easier to pronounce. Tschernogbow. Chernobyl. We're going to call him Chernobyl. Published the first comprehensive description of what is now known as EDS. One of his patients at the Moscow Venereology and Dermatology Society had such fragile skin that it couldn't hold sutures, plus his hypermobile and luxating joints. He also had those along with molluscoid pseudo-tumors on his knees and elbows. He had a lot going on. In the late 1800s, some people with EDS performed in like circuses and traveling shows. Since Gimli's making so much noise, I don't know what he's doing. I'm so sorry. Oh my goodness. Okay, moving on. Since they had stretchy skin and loose joints and could contort themselves in ways that people without EDS could not, they used their physical abilities to show off in circuses and shows. Actually think it's our roommate's dog that's trying to break in to eat Gimli. So hopefully she does not make it in. But yeah, I will just ignore that for now. In 1901, Edvard Lorentz Ehlers added the tendency of bruising to the known traits, flax joints and elastic skin. The patient that presented with bruising also had a history of delayed walking due to the frequent knee dislocations they experienced. And in 1908, Henri Alexander Danlos examined a patient that had been previously diagnosed with juvenile pseudo-diabetic xanthoma. He presented with lesions over, or the patient presented with lesions over their knees and elbows. So Danlos refuted the previous diagnosis and, with further investigation, attributed the lesions as vascular and inflammatory due to trauma. I'm assuming from the loose joint dislocating thing, traumatic. My last recording cut out after 5 minutes, so I'm gonna have to keep my eye on the clock. I thought it just did not start recording at all, and I got scared. It did. I don't know why it stopped. I'll try to make sure it doesn't again, but I said a lot of information that was not recorded, so I'm gonna try starting from that spot again. So, Danlos examined a patient There was misdiagnosed, blah, 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 lesions due to trauma. So, with these more complete symptomatic descriptions that Ehlers-Danlos contributed to, we see many cases of EDS popping up starting in the 1900s, with over 300 cases documented in 1966. In 1949, it was hypothesized that EDS was an inherited autosomal dominant trait, after 32 patients with familial relations presented with EDS, and it was later concluded that... Sorry, my water is making me burp. It was later concluded that the phenotype was caused by a genetic defect of collagen of the connective tissue. In 1972, this idea was confirmed with the finding of a lysyl hydroxylase deficiency in an autosomal recessive form of EDS. Patients with this deficiency were prone to scoliosis and the rupture of the ocular globe. Ew. But this made EDS the first confirmed disorder of collagen. So that's exciting, opening a new door of defects that we know about in the human body. So that's fun. In the late 1960s, classification of EDS began, and in 1988, 9 subcategories were proposed. But now EDS is classified in 6 major types that are separated according to the Via Franca Ethology. These classifications showed that EDS had no preference between like male, female, or different races. It was equal opportunities. Let me check my recording. Still going. Okay, we're 3 minutes. So far, so good. So the types of EDS, gonna go into that. Type 1 and 2 are considered classical EDS. It's a dominant trait, and the defect comes from an abnormal type. Excuse me? It's a dominant trait. The defect comes from an abnormal type 5 collagen. Don't know what that means, but that's what it is. These 2 forms present with skin laxity, scars, joint hypermobility, easy bruising, muscle hypotonia, and hernias. Type 3, hypermobility EDS, is a dominant trait, and the defect is unknown. It presents with skin laxity, velvet skin, joint hypermobility, and recurrent joint dislocations. So those 2 types, classical and hypermobility, are the main types. I'm pretty sure I read that it was like 98% of EDS cases are those 3 types, I guess. Don't quote me on that. But I'm pretty sure those are the 2 most common. Type 4 of EDS is vascular EDS. It is a dominant trait, again, comes from an abnormal type 3 collagen, and it presents with arterial rupture, easy bruising, hypermobility of small joints, and varicose veins. Type 5 is skipped over in a lot of the graphs and charts and information. Hello, Gimli. He is coming and sitting on my lap. So he is on my yarn, so I suppose I will not be crocheting. Type 5 is skipped over a lot. I think it's really rare. From what I can find, it is an X-linked recessive trait, which means nothing to me. Maybe it does to you. I do not know. But it's a severe type in males, and it leads to congestive heart failure due to polyvalvular disease. The severity in females is more variable, so it can be that serious, or it can not be so serious. Yeah, that's all I know about that. Type 6 is kyphoscoliosis, EDS. It is a recessive trait, yay. It's caused by deficiency of lysyl hydroxylase, and it causes joint laxity, muscle hypotonia in infants, scoliosis from birth, and sclerofragility. The first part of type 7 is arthrochalasia EDS. It is a dominant trait caused by deficiency of chains in type 1 collagen. It causes joint hypermobility and discoloration, skin laxity, easy bruising, muscle hypotonia, and kyphoscoliosis. And then the other part of type 7 is dermatosparaxis. It is a recessive trait caused by a deficiency of enzyme in type 1 collagen. It causes sagging, redundant skin, soft, doughy skin texture, easy bruising, hernias, and premature rupture of fetal membranes. So, yeah, those are the technically 6 types, I guess, of major classification. All of these types have the tendency to cause the patients to bleed, which can present as mildly as just bruising easily, or as severely as they can form hematomas and internal bleeding, which is not good. But their lab work shows normal clotting factors and platelet clumping and bleeding times with connective tissue disorders, so they have those normal values, but still have trouble with bleeding. So that's no good. The type of EDS with the worst prognosis is type 4 vascular. It can cause severe and fatal ruptures of the bowel, large arteries, and other organs. It has also been known to cause cerebrovascular bleeding in young adults, which causes intracranial aneurysmal rupture, spontaneous carotid cavernous sinus fistula, and cervical artery aneurysm. With this type, the skin is it's not hyperelastic, but it is thin and translucent, like a ghost. So, but type 4 is the most serious, worst prognosis type. This recording is almost 5 minutes, so I may get cut out soon. I'm gonna keep going though, because I can't live in fear like that. So, newborns with type 4 EDS can be born clubfoot or with congenital dislocation of the hips. As they get older, these children may develop a pneumothorax, inguinal hernia, and recurrent joint dislocations. Hi, Ponyo. He's coming to check things out. You can probably hear his little clicking little toes. Oh my goodness. It cut out again. At least Ponyo got to say hi in that one. I was saying after it stopped recording, I'll have to post a picture of Ponyo and Gimli on the Instagram when I post this, because they're so cute and I love them so much, and they deserve to be seen by you because they're so cute. But I also started a stopwatch this time because I don't know why it keeps cutting me off and I don't like it. I'll have to figure that out after this is done, but I want to just get through this for now. So, moving on. Where was I? Okay, I thought I hit Ponyo with my elbow, but it was just my water bottle. No worries. Newborns with type 4 EDS can be born clubfoot or with congenital dislocation of the hips. As they get older, these children may develop a pneumothorax, inguinal hernia, and recurrent joint dislocations. So, quick public service announcement. If your child exhibits excessive bruising, take them to their pediatrician. And if your child has delayed development, take them to their pediatrician. I work in the medical field, I guess, in an office that sees a lot of kids for speech, occupational, and physical therapy. So a lot of kids are coming in with like delayed development, which can be worrisome and mean there's an underlying condition that's a problem, or that they just need help, or it could not be. So if you have any doubts about the development, about weird things that don't seem normal for kids their age, please go to the doctor, because it can never hurt unless you can't afford it. But if you can afford it and can have access to a doctor or some sort of therapist for an evaluation, do it if you think you should, because it cannot hurt. So, yeah, please. That's actually all I could find on EDS and the history. Is a lot of more jargony than I would like, but that's what I got. And I thought all the different types were interesting, even though I don't understand genetics. And I don't understand what any of that meant. With all the different, I mean, I kind of do, but it does not entirely make sense to me, but I still thought it was kind of interesting. And if I cut it out, there was just not a lot of information. So we kept it in because I had to, basically. I mean to make, this one's going to be closer to like 20, 25 minutes, which is good. Longer is better. I did not mean for the first episode to be so short, but there just wasn't a lot on Lyme disease. There was less than I was expecting with EDS, to be honest, because I feel like I follow a lot of like social media chronic illness influencers that have EDS, and I feel like I've been tested for EDS before, like since I was little, because I like have like some hypermobile joints, but like not EDS, not enough to be EDS. But I feel like I've always known about EDS, so it's weird to me that there wasn't more information. But there was not. So still not a super long episode. That's okay. It's fine. Just a couple of things before I finish up. Since I'll probably be at least some, hopefully, going in to more underrepresented conditions and diseases, I may just need to find like more segments or something to add some length to the episodes. So if you have any ideas, let me know. And again, if you have any disease or condition suggestions, also let me know. I've been getting a few, quite a few actually. So thank you to everyone that reached out. I appreciate it. Follow my Instagram, Crocheting Through History. That one's more exciting to me. A lot of people reached out, like commenting on the post I shared to my personal Facebook. But that's not as exciting as people following my Instagram that I made for this. So give that a follow. I appreciate it. You don't even have to look at it. Just follow it so I feel good about it. Thank you to everyone who has. One of the segments I was thinking about, though, was like naming historical figures that had the conditions. Unfortunately, for this one, I found like 4. Paganini, who's a violinist, very famous, used his hypermobile fingers to play real good violin. Probably hurt himself in the process. And damaged his joints doing that. But you gotta sacrifice for your art, I guess. And then the other people I could find were people that traveled in shows and circuses, and were known as like Elastic Man, Stretchy Person, whatever. But their real names that I found were Felix Worley, James Morris, and Avery Childs. So that's 4 people right there. That's all I could find. So yeah, may or may not be a viable thing to research in the future, but we'll try anyway. Research wise, thank you to Leacat Parapia and Carolyn Jackson and the British Journal of Hematology within AE, because it's British. They wrote the article that I got a lot of this information from. So thank you to them. Also thank you to the EDS researchers. Edward Ehlers, whatever, Honoree Alexandra, Danlos, Job Jansun Van Mikren, Dr. Shur Nogabo, and many more, I'm sure, with names that I still could not pronounce, so maybe it's better and more respectful if I don't try. Also, thanks to some of the influencers I mentioned I follow with EDS, mainly Izzy Kornblue, I don't know. She has EDS and she is going to school to be a genetic counselor, so she can learn more about EDS and other hereditary disorders, and help people and families and research, hopefully. So kudos to her. Also possibly Allison Tennyson, aka Micro Cat Machine. That's her Instagram handle. She's not diagnosed with EDS because the doctor she went to didn't diagnose adults with EDS. So unsure of that, but thanks to her anyway for being a chronic illness influencer. And hold on, this episode recording's about to stop, so let me just get ahead of that. Shout out to my roommate Kim, who has EDS, and also shout out to everyone else living with EDS every day. I hope that if you are listening, you could learn something from this, hopefully. That'd be cool. If not, I get it. But there's also not that much information out there, so I also would not be surprised, I guess. But, oh, I also have to mention, yes, my Instagram is crocheting through history. It is not like I corrected myself last week, crocheting through medical history. It is simply crocheting through history. That was embarrassing, realizing it after I had posted that I was wrong, and I corrected myself wrongly. Very awkward. Whatever, we're moving on. It's okay. Yeah, follow that. I guess that's really all I had to say. Have a great day. Have a great weekend. Stay warm if you live where it's cold like I do. I'm like halfway through crocheting the zebra, and he looks real funky. He was gonna be very long, like a torpedo, but that's fine. I'll post a picture when I'm done. Thank you for bearing with me. I will try to become more smooth and figure out how to record more than 5 minutes at a time so I don't get cut out quite so much. That will be my goal for next week. Thank you for bearing with me. Thank you for listening. Give me your topic suggestions, and I will talk to you next week. Goodbye.